And this is another thing. This show me is it's a bunch of tools, a suite of tools that are is there to help enhance that communication. That if you have a child or a family or an adult that has any communication challenges, and thinking about how to enhance that communication with emergency management personnel and volunteers. There's a number of tools there that are available. And this is again something that's available on the mass.gov, but really helpful. We've heard from a lot of families in our home assessment project that, especially for some of our children or youth that might have some communication challenges, we want to be able to help support our first responders who are coming in who don't necessarily know and really help understand. So these types of tools, there's free mobile apps that are, looking, you can help with shelters and, thinking about these mass casualty and mass fatality incidents. These things can be life-saving. So again, a tool for you. The next slide is something, it was actually it was a family and a patient of mine that really helped me think about and, highlight this. And I had a little girl who had a syndrome, which unfortunately shortened her lifespan to less than 5 years of age. And so as we were doing a lot of planning early on, and at one point when her mom decided to, have a do not resuscitate order. And, we certainly were able to address all of that when she would come to our hospital and with the different providers. And it was something that we took care of. But, we learned and worked really hard on also having a do not resuscitate order for at home that really is helpful for, it's not like mom might not need to call 911. So, what aspects of emergency response would be appropriate. And mom was very concerned about this, especially when she wasn't in her care, that there was a communication plan for emergency responders around DNR. So I really wanted to put that in there as a resource and something to consider. While it might be a small number of children, it's an important consideration. And again, this to me gets back at family goals. One of the questions I always talk about with families in my own practice is, what are your goals for Johnny? And let's talk about that. And it's a privilege to be a part of that goal setting and planning with you. And so whoever that is, and obviously my lens is as a healthcare provider, but I just think it's important even on the family side to be able to have an environment of mutual trust where you can establish those goals, because then that helps that foster that communication and trust with emergency first responders. So you guys are doing great. Hang in there. This is just a slide of the one of our partners and advisory board members, Eileen Thompson from the Pennsylvania chapter of the American Academy of Pediatrics, who I have the privilege of working with on our Pennsylvania Medical Home Program. We partner with Une and Peel as well. And just, as I mentioned, I feel like that neighborhood includes the medical home. And as a provider, and it was something that came up, I think Jacqueline mentioned too, some of these things really should be things that we should be doing and educating healthcare providers on these things so they can support family members. So wanted to put that in there.